COVID-19, while of course they have in some sense dipped in some of the states, but the Election Commission of course believes that there are cities that continue to be affected like Mumbai and Delhi. But COVID of course is tightening its grip in South India. That continues to be a cause of concern. Cases are crossing 45,000 in Kerala and Karnataka. Delhi, while Kerala has tightened curbs, Karnataka has revoked the weekend curfew, refueling the debate on whether to open up or not.
The third COVID wave has loosened its grip on North India. But a significant surge in cases has been recorded in South India. For the last 2 days, Karnataka has recorded over 47,000 cases of COVID. Infections are multiplying at an unprecedented rate in the state. Amid the COVID explosion, the state government has decided to ease weekend curbs with a caveat. The curfew will be reimposed if hospitalizations go up. Further south, the situation is different. As a COVID tsunami sweeps Kerala, the state government has announced fresh curbs. With over 40,000 cases being recorded daily, the positivity rate has exceeded to 40.21%. A total lockdown has been announced for the next 2 Sundays. Malls and theatres will remain completely shut on Sundays. There will be online classes for school students. Schools will not be completely shut down unless COVID clusters form. Religious functions are to be held online. Each district administration can decide on new restrictions based on cases, including for theatres and bars.
We have a total of 1,99,000 plus patients now. Only 3% are hospitalized. Among them, 0.7 needs oxygen beds. 0.6% is in ICU. That means that we have the hospital occupancy is very less now. So there is nothing to worry about. But everyone should be very careful. You wear mask, observe social distance and all. So that's it.
In Delhi, the weekend curfew will remain in the national capital despite a decline in daily COVID caseload. Delhi Lieutenant Governor Anil Bajal turned down the government's recommendation to lift the weekend curfew.
दिल्ली के अंदर नंबर ऑफ केसेस भी कम हो रहे हैं, पॉजिटिविटी भी कम हो रही है. इस टाइम काफ़ी कंट्रोल में है. 28,000 पर आने के बाद, पीक आने के बाद अब तेज़ी से केस नीचे गिर रहे हैं और पॉजिटिविटी भी तेज़ी से 30% से जाने के बाद घटते घटते 17-18% पे आ गई है. तो दिल्ली के अंदर पीक जा चुका है और केसेस कम हो रहे हैं.
Weekend curfew will stay intact from 10 a.m. on Friday till 5 a.m. on Mondays. The odd-even formula for shops will also continue in Delhi. Public transport can run at full capacity and private offices have been allowed to run at 50% strength. The same rule will apply to pubs, restaurants, theatres and malls. Only essential services will be exempt from COVID restrictions. Experts say the peak in Delhi and Mumbai are over, but hospitalizations may not go down soon.
You know, how bad is the situation in terms of the peak getting over in Mumbai city, for example? A lot is being said that the worst in Bombay is over. What do you have to say?
Well, worst is always in 2-3 ways. So, for example, you can have a worst in terms of number of new cases. I think the worst is over indeed.
In Mumbai?
In Mumbai, yeah. I think the cases are on the way down. We have already crossed the peak over there. Even in Delhi, we have crossed the peak. We may not see a decline in the hospitalizations and ICUs and deaths for some time. So in that sense, the worst is not over. And while there is no evidence in any of the global data of high amounts of MISC, we will only get to know, in due course of time.
India is in the middle of a third wave of COVID. The wave is peaking in different states at different times. With Sneha Mordani in New Delhi, Bureau Report, India Today.
What are the long-term effects of Omicron? Will the symptoms of long COVID be the same as the Delta variant, or will it be better vaccination rates in fact might help? Sneha Mordani speaks to experts.
Mild infections, less severity in majority of the cases all over the world. By and large, that is how the clinical picture of Omicron is looking like. But how bad can things get after recovery? In short, how will Omicron-induced long COVID look like? Experts say it's a little early to say, given the variant has been identified just 2 months ago.
Is there any kind of symptom which is persisting after 4 weeks? So we really have to wait for this kind of wave to abate and follow up our patients in outpatient to see if they are getting any kind of problems.
Some doctors say early symptoms are mostly fatigue after the patient has turned negative on RT-PCR. But some things may not change.
Patients who are recovered from mild infection, they usually complain of backache, body ache, lethargy and post-viral cough, which usually resolves in 2 weeks. So that is the maximum period we are seeing the symptoms even after recovery.
But some things may not change. Be ready to see symptoms of multi-system inflammatory syndrome in children, warn some experts.
In terms of the number of cases, the peak essentially is over in Delhi and Mumbai. But what one needs to be cautious about is MISC in children, and also that there could be more hospitalizations in terms of a fallout of the infection of so many weeks or so.
Yeah, so we may not see a decline in the hospitalizations and ICUs and deaths for some time. So in that sense, the worst is not over. And while there is no evidence in any of the global data of high amounts of MISC, we will only get to know, in due course of time.
Some experts cite data to show vaccines may just. A study published in the Lancet Infectious Diseases journal found that people who had received 2 vaccine doses and suffered breakthrough infections were about half as likely as people who had not been vaccinated to report symptoms lasting at least 28 days after their infection. About 5% of those with breakthrough infections reported such lingering symptoms, the study found, compared with 11% of infected people in an unvaccinated control group. The study was based on reports to a phone app by more than 1.2 million British adults who had received at least 1 dose of a coronavirus vaccine between December 2020 and July 2021.
The vaccination provides protection against the COVID. It prevents not only the acute symptoms of COVID, but also it prevents the occurrence of long COVID, as this was stated in a study published in the Lancet in the January 2022. So at the earliest opportunity, we should get ourselves vaccinated.
It will be a while before we learn about the long-term impact of Omicron in terms of long COVID. A host of factors will determine this, like population demographics and also vaccination rates. Up until then, it does appear that there are no major surprises when it comes to long COVID because of Omicron. In New Delhi, Sneha Mordani for India Today.